A root canal treatment, yes, this is the most common procedure what a dental clinic will usually have. Endodontist is usually a specialist who performs root canal treatment. So there are many specialties in dentistry, as all of you know, but endodontist does root canals and other procedures as well. So what is a root canal treatment? A tooth, as you know, is white in color, right? Tooth is made up of 3 layers: enamel, inner middle layer is dentin, inside layer is pulp. When I say pulp, it has life, it is blood, it has nerves. The dentin is a second layer which has minimalistic dentinal tubules or the nerve endings which can give sensitivity to the patient. The topmost layer is lifeless. So as and how the age progresses, the top layer of the teeth goes away. Then the protection of the tooth is gone. Then as and maybe over a period of time, 50, 55, 60 years, the second layer will start getting exposed, which is second layer is dentin, which has little life or nerve endings, which will give you sensitivity. As and how it goes deeper, then it will start attacking the nerve, and that is when the pain will happen. So this is over a period of natural progression also it can happen, or even for youngsters also. The cavity, you know what a cavity is? It's nothing but bacteria and other microorganisms which attack a tooth, and it will eat away the first layer of the tooth enamel. You won't have any pain. Second layer it will come dentin, the pain starts, and from dentin it is like a very soft area and then gets into the pulp. So once it gets into the pulp, the infection spreads into the canal. So a tooth will have 2 roots or 3 roots or single root. Okay, a canal is a canal inside a root. So there can be 2 canals, 3 canals, or sometimes 4 or 5 canals also in one single tooth. So what we ideally do, we clean up the canals, the root canal treatment, meaning the roots inside that canal. Inside the canal will be the nerve tissues and the blood supply, which will be infected by the cavity. So we clean it up and then we again refill it with a artificial, most commonly used filling is Gataparcha. So we put Gataparcha, then we seal it up on top, and then now since this tooth is devoid of blood supply and nerve supply, generally the load bearing teeth, what we do, we give a crown on top of it to strengthen and reinforce the brittle tooth. So this is the main process. The root canal generally is completed only after giving a crown on top of it. So now how many types of root canals are there? There are 2 to 3 variants of root canals. That is, at least 2 you should know. One is a manual root canal where the dentist or a root canal specialist will do it with the hand, inside out with the hand, and keep on taking X-ray and then do it. The second type is called as Rotary Endodontics. The Rotary Endodontics has a very specialized motor which goes exactly to the tip of the root, and then the dentist has to identify, locate it, and then hold it, and in itself will drill. And the fillings that we have is like a stick. The Gataparcha filling will be as the same morphology of the burr that we are using or the drill that we are using. So directly you put it inside and then it will be absolutely sealed. So go in for a rotary endodontics as compared to the regular endodontics. However, there are few indications for manual endodontics also, but invariably, generally it is a rotary endodontics which is absolutely the best possible thing. So go to an expert, ask for rotary endodontics, ask for root canal. What are the other alternatives for root canal? Removal of tooth. How do you replace a tooth? Implant. Might as well take a root canal root and then fill it up and then take a cap on top of it, generally. What is the success rate of root canals? 90 to 95% of the times the root canals need not be visited in future. There is no maintenance of root canals as well. So only 3 to 5% re-root canals have to be done. That also is not, an experts can do that. Remove the crown, remove the filling, again redo the root canal. Re-root canal chances of survival can maybe it lessens depending on the patient factor and the general morphology and the medically compromised or medical condition of the patient.